Information is going to be shared, and we also want the ears to be open, the heart to be big, so that you might hear and then internalize it so that as you go back to your community, you will have the ability to help advance and implement smoke-free housing. And one of the reasons this is a big item on the agenda is that everybody knows that there's a new regulation that requires all housing authorities to become smoke-free. And so often regulations are passed without a funded mandate. But in this instance, one of our partners had the vision to seek funding from the Robert Wood Johnson Foundation to create a partnership that allows a number of us, a number of organizations with multiple partners to be resources for resident councils, for resident services, to help implement smoke-free housing. And in some instances, grant dollars are available to partner with the resident councils. So we're going to use this session to talk about that, and then a much smaller session where you can engage more intimately and specifically with us, can visit the exhibit tables to get information. We want to be a resource for housing authorities, for resident councils, for resident services around the country in helping to implement smoke-free housing in a very helpful way. Because there are instances where smoking cessation assistance may be needed, therapy may be needed, special treatment may be needed, and those are the things that we want to be able to have resources for and information to connect you to help families. It is not difficult in many instances, those who smoke who want to kick the habit. So there's a lot that is involved in this that can be a tremendous resource for your families of all age groups. So this is not about spanking anybody, but rather it's about helping in every possible way. And we have a distinguished panel of partners who are with us today. I just want to take a moment to call their names out, and each will have an opportunity to share information, and our partners are continuing to grow around the country. So I want you to take this very serious, engage with us, and allow us to be a resource in your community and to be helpful to you where we possibly can. So would you please take your seats, and we want to begin this session. We are delighted to have, as you see printed in the program, two members from the NAR-SAAH team, Dr. Vincent Leggett and Ms. Joan Marsh, both who are part of the national training team with NAR-SAAH, who are engaging with resident councils around the country, providing TA and assistance and seminars and training sessions and Skype meetings, anything that we can do to connect with you, to help answer questions, etc. These are two of our team members who specifically help with that. We're very delighted to have Mrs. Cara Scalham from the Association of Non-Smokers Minnesota, who was the brain trust around helping to get a big grant from Robert Wood Johnson Foundation to do this work. So why don't you even just give her a hand of applause for her passion for families and willingness to take the time to do the research, to put an award-winning document. And this is the first time there's been some funding to help with this. And we are trying to be as supportive and as helpful as we possibly can. We're very glad to have Ms. Pat McCone from the American Cancer Society with us. Welcome, Pat. And also Ms. Becky Simone from the American Cancer Society. Pat's from the American Lung Association, and Becky is from the American Cancer Society. And these are just two of the many partners that we're working with to be a resource for you. This is a great team, an opportunity to go in some new directions, and let's take advantage of the information they have, and there will be an opportunity at the end to engage with them equally as well. And I'll yield to NAR-SAAH first. Vincent.
Good morning, everyone. My name is Joan Marsh, and I'm with the NAR-SAAH group. And right now, I think what we need to do is to stop what we are doing and acknowledge Dr. Samuel Little and the program he has put together for this conference. Yes. A magnificent job, and of course to the board members and also to the staff who's working along with him. We are so excited to be a part of this smoke-free campaign with the NAR-SAAH and of course with our collaboration with the American Lung Association, American Cancer Society, and all of the other supportive organizations in the various communities where we live. And that's our message to you from the NAR-SAAH standpoint, is that Dr. Vincent Leggett and myself will be working with you as public housing organizations. Whenever there's a need for you to call on us to share resources, we will be there. One of the things that I've done recently is in the state of Indiana, because that's where I live, just took an assessment of all of the housing authorities there to determine what kinds of things they are doing as a result of this policy that had to be put in place by July 31st, 2018. And most of you are aware that there is a policy and that your organization has a policy. I would suggest that if you don't know, or if you have not heard, or if you don't have a copy of that policy from your organization, please go get it, figure out where it is, talk to your executive director, and make that a part of your agenda for the next meeting that you have as resident councils. But in the state of Indiana, for example, let me just share one of the stories that I have to come forth from that. In Fort Wayne, Indiana, and I don't think we have anyone here today from Fort Wayne. Do we have anybody here from Fort Wayne? Well, let me tell you one of the things they've done in collaboration with the American Lung Association. They decided that this policy is so important that we want to make this what they call campus-wide effort. Every community in Fort Wayne that's associated with public housing has their own manner of delivering service, has their own manner of showing that this is a smoke-free campus. They have T-shirts, they do programs, they do things that are youth-focused, and every community creates its own avenue to demonstrate that they are smoke-free. And that's something that everybody can do. Would you agree? No. Yeah, of course you can. Somebody said, no, we can't do that. This is about positivity, am I right? Yes. So we will go back and we will figure that out. We will go back and we'll say, this is our community, and this is how we're going to make it a smoke-free campus. This is how we're going to make this a smoke-free building. And if you start it, the people will come. That's what the other lady who was just up here said. You've got to start it. You've got to make it important to you. And if you make it important, it will be important to the residents, consumers, to the people who come on your campus. With that, I will have Dr. Leggett to come forth and say what he has to say about the smoke-free effort.
Thank you. Again, my name is Vince Leggett, and I'm serving as the National Director of Training with NAR-SAAH on this smoke-free program. Just a little bit about my background. I'm a former executive director of 2 housing authorities in Maryland. And for about 3 or 4 years, we were working with HUD as we were developing the final rules, because even though the policy just got implemented with an effective date in July, studies and focus groups have been going around the country for the last 5 or 6 years. And our housing agency was one of the groups that were early on involved in the process. One of the things we did do was engage Morgan State University, which is based in Baltimore to serve as focus group leaders. So often trying to have HUD or the Housing Authority talk directly to residents about such a volatile issue, we had to bring in a third independent party to actually help engage in that conversation. One of the messages that came out of the focus groups was that whether you were a smoker or a non-smoker, everyone agreed that secondhand smoke was a problem. No one that we surveyed put their hand up and said secondhand smoke is not a problem. So that became the beginning point. We had senior citizens walking around with an oxygen tank and 2 cigarettes, creating a health hazard not only for themselves, but for everyone else living in an 8-story tower. We had done research showing that in the public school system, asthma and respiratory problems lead to a very high rate of absenteeism in the schools, subsequently poor grades. If you aren't in school, you can't make the grade. And so again, we're at the stage now, we aren't debating whether the rule is the right rule or the wrong rule, it's the law of the land. And so our panelists that we have with us were individuals that had the vision, they've been on the battlefield for a number of different years, and so we're collaborating with key partners to help bring that message out. We aren't saying that you can't smoke, we're just saying you can't smoke in your units. And again, it was the same way with seat belts. People protested that. Smoking in restaurants, airplanes. You could never smoke in common spaces in your communities anyway. You couldn't smoke in a rec center and those kinds of places. And so we're here to share with you tools and strategies that are being used. Joan and myself will be moderating a session where we could really get down into the how-to. One of the things I've heard from the workshops that we've been coordinating is that a number of our speakers have great ideas, but don't tell us how to. Come to the follow-up workshop, and we're going to get to the how-tos. Thank you.
All right, good morning, everyone. Good morning. Can I see a show of hands? Can you raise your hand if your life has been impacted by tobacco? So does that mean you're a smoker, you have a family member who smokes, you have a loved one that has a health issue due to smoking, or you have been impacted in some way, you have breathed secondhand smoke? So if you look around, there are a lot of hands up in this room. Thank you. And I just want to say that part of the reason why I'm here and part of the reason why I care about this work is because my life has been impacted by tobacco. I have smokers in my family. I have non-smokers who've been impacted by secondhand smoke in my family. So I get both sides of the issue, but that's why I'm here. I also want to see a show of hands. We all know the HUD rule's a thing. Can you raise your hand if the HUD policy for your building for smoke-free has gone it's gone perfect. There have been no issues whatsoever. It's gone really, really well. Excellent. I'm seeing a few hands. Thank you. Raise them high. That's great. Raise and be proud. That's great. All right. Can you raise your hand if it's gone so-so? There have been a few problems, but things are coming along. They're progressing. Wonderful. Thank you. I see all of you. And can you raise your hand if it's been a real challenge? There have been a lot of problems. There have been a challenge. All right, we're seeing some hands. Thank you. Well, I want to let you know that we, and when I say we, this whole panel of folks, and we have a lot of folks that we work with nationally, are here to help all of you and provide support to all of you, and we want to hear all of your stories. So I just want to, I guess I'll back up a second. Who am I? My name is Kara, and I am with a program called Live Smoke Free. Some of you maybe saw me yesterday. We are a nonprofit program that is really excited to be partnered with NAR-SAAH and also with a program called NAR-SAAH, so the National Association of Housing and Redevelopment Officials. And so our goal, and along with our partners from American Lung Association and American Cancer Society, is to provide resources and to support to all of you. So y'all know that the HUD rule is in effect, right? So July 31st, it's in effect. So smoking is no longer allowed inside of units, in the common areas, or within 25 feet from the building. So HUD is saying if you want to smoke, you got to take it outside. As Mr. Leggett just said, that's the rule of the law right now. So the policy may look a little bit different regardless of where you live. It may look a little bit different from building to building. But as I mentioned, the goal of our program and everyone on the stage is to meet your building where you are and provide resources for you. So what does that look like? So that could mean if you want assistance talking to your manager about a challenge in the building, that's something that we can assist with. If you're looking for resources, so that could be signage, that could be door hangers, that could be resources to engage kids or games, or having someone come on site and do a celebration or a party. For example, you could do a smoke-free anniversary. Those are all things that we can support with. So whatever questions you have, whatever resources you need, don't hesitate to reach out. We're available for you. So I spoke with a lot of you yesterday already at the exhibit table out in the hallway. And I talked to some of you who love the rule. I talked to some of you who hate the rule. I talked to some of you who are still kind of feeling the rule out. And that's absolutely okay. So the way every single one of you feels is okay. We're here, and what struck me yesterday as I was speaking to folks was that we are all here, and we're all here at NAR-SAAH because we care about our homes, we care about our communities, and we care about our neighbors, and we want to make sure that folks feel comfortable. And that's why we're here too. So regardless of where you are, if you love the rule, if you hate it, if you're somewhere in between, we want to hear what you think. We want to listen to you. We want to be supportive of you. And we want to be able to make this transition easier, as easy as possible for you. So again, please contact us. If you came to the table yesterday, you probably heard me talk about some of the benefits of a smoke-free policy, right? We're talking about less smoke in the air, we're talking about cleaner buildings, we're talking about reduced risk of fire. But we also recognize, all of us up here, that change can be really difficult, that nicotine can be a very strong addiction, and we don't minimize that. We also recognize that not everybody's happy about HUD's policy, and that's okay. Again, we're here to work with you. So as part of our project, we are going to be documenting resident leaders and the residents and staff's thoughts, questions, and concerns about this rule. So as I mentioned again, regardless of how you feel, we want to hear from you, good, bad, or otherwise. Also, as was mentioned, please join us after this session. We're going to be digging deeper into this topic, and we want to hear how you feel about this. So please come to this session directly after this so we can hear more about your thoughts and questions and concerns. And with that, I'm going to pass it on to Ms. McCall.
Good morning, and thanks for your good work. My name is Pat McCone. I'm a regional director with the American Lung Association, and I'm the product of public housing. I was raised in public housing when it wasn't so cool. And I think I'm really honored to be part of this process because I was that child of the single mom that had kids and through no fault of my own was stuck in public housing. And I deserve the right to breathe clean air as much as people that own their private homes. And that's what this is about for me and for our organization. This is an issue of social justice. It should be everyone's right to breathe clean air. And with that, I also want to say that my only sister was developmentally disabled and lived in public housing her whole life, and I was her guardian. So I appreciate resident managers, I appreciate resident advocates because they've helped me, they've helped my family, and they're important parts because part of what we provide in housing is safe and healthy, and that's what this is about. Now, the special population that our project is focused on is people with mental illness and substance use disorders that live in public housing. And again, through no fault of their own, they have a disease that has that sometimes sets limitations on what they're able to accomplish in a lifetime. And therefore, many people that struggle with mental illness and substance use disorders live in public housing. And we don't want those people to lose their housing over tobacco, because to me, the only bad in this issue is the tobacco industry that has targeted vulnerable populations. And we want to help work with those residents, those loved ones. I even hate the labels. These are brothers and sisters and mothers and fathers and grandparents. We want to work with you and work with them to understand the why of the policy, how they can manage if they're not ready to quit, because this policy doesn't mean, okay, now you can't smoke. It means you can't smoke within the properties. How you manage that to be able to stay in that housing. We have some great tools, and we have some great partners, and we have some partnership opportunities. I loved the keynote speaker. I think I really needed that today. It was so amazing. As a nonprofit organization, I would encourage you to think about your first organizing activity of registering and getting residents out to vote. Okay. Nonprofit organizations have a responsibility to promote that. I'm not telling you how to vote. I'm just saying that is one of the really first things you can do with a tangible deadline, and you can energize and excite and then engage those same residents in how we make the smoke-free rule the positive that it is, the social justice issue that it is, the issue that everyone deserves the right to clean air no matter where you live. So we don't have donuts at our breakout, but I've got some great handouts and some more practical tools for working together. Thank you very much.
Good morning, everybody. I'll be the caboose up here today. Hi, I'm Becky Slemons, really named Becky. I'm from the American Cancer Society. I live in Atlanta, and I'm representing, am I too close to this? Can you hear me okay? I'm representing a new grant that is also funded by the Robert Wood Johnson Foundation that has brought me into the orbit of all of these fine people. We are going to be working in 6 communities, one in California, one in Florida, one in Missouri, one in Pennsylvania, one in Kentucky, and I'm forgetting somebody, hold on. South Carolina, one in South Carolina, to basically create a circle of support for residents who are ready to quit smoking. We're going to be working with the PHA directly. We're going to be working with the community health center near the PHA, and then also the state quit lines to get everybody the support they need. But before that, just to know what's available to everybody to quit smoking. You don't have to go it alone. Only about 4% of people actually quit smoking cold turkey. We recognize how hard it is. Yeah, there are people in here, people I talked to yesterday who did, and you are very much the exception, not the rule. And it doesn't have to be terrible. There is support for you. There are medications and other types of help that you can get access to. So we want to let you know what is available, how to access those things, and how to get ongoing support, because it is a process. Did you know that most people quit around 14 times before they finally stop smoking for good? Every single time you decide to quit and make an effort to quit, it's a step in the right direction. It's a step toward quitting for good and not only helping your health, but the health of people around you. And even more so than that, for children to see that the people around them aren't smoking and they won't start in the first place, and we live this cycle all over again. So the American Cancer Society is new to working with residents of public housing, but we are not new to the space of helping people quit smoking, and we are not new to what I think is the most important aspect of all of this, which is health equity. As was talked about a minute ago, the marketing has targeted people of color, and it's targeted people who live in public housing, and it is hard to pull out of that when you're constantly being bombarded by images. So something that is important to me personally, but also to the organization, is just to level the health playing field a little bit, which sets the stage for a lot of other amazing things that can come out of that. So with that, I will yield to our moderators, but just thank you for allowing me to be here and for allowing our organization to be a part of this.
Well, you've you've heard our opening statements, and again, there might be some follow-up questions, and again, we're going to get into a lot more detail in our breakout session. But if it's okay with you, Dr. Sam, we can entertain some feedback from the audience, and you might tell us logistically how best to go about that. Yes, one of our national board members.
Well, if the chairwoman stands, I have to give her the mic.
Thank you so much. And I'm very pleased that you all are here and working so diligently to address the form of addiction that first set in here. They talk about opioids, but this came before opioids.
Yes.
And a lot of us didn't know, like they didn't know today. My question, because we're talking primarily about public housing, and I know that's what the grant is addressing, but we have learned at this conference that many of the public housing communities are going to undergo this process called RAD, which is going to transform them from public housing into privately owned or nonprofit owned housing. And the regulation that governs making housing smoke-free currently is being implemented for public housing, but what is the projected future to bring, for example, all of the Section 8, or whether it's a place-based Section 8 or insured housing, subsidized housing, tax credit housing. Privately owned is a much wider universe affecting low and moderate income people to deal with this problem. I'd like to know, is there plans or is there a projection on when the rest of the HUD housing is going to come under this rule for smoke-free housing? And then there's a follow-up that talks about marijuana. But let me hear about you in terms of the plans for addressing privately owned housing to access these resources.
I'm just going to jump in with a partial answer because I don't have all the answers. It's a great question. It goes back to my premise. Everyone deserves the right to breathe clean air. And it goes back to the initial speaker. You have to organize and have that voice. You have a position on the board. I partially think having a smooth implementation in public housing is going to dictate those next steps. If our voice is, it was crazy, it was unenforceable, this was the worst thing that ever happened, it's not going to move forward. It's not going to change overnight, but I think, again, with that positive vision of here's how we get there together, and everyone deserves the right to breathe clean air. I know our organizations are going to continue to be the voice for that, starting in communities and states, and then the federal government, but we're not going away. I flew here on an airplane. I do remember the times when you could smoke on an airplane. The reason we have smoke-free airplanes is because the union for the flight attendants sued the industry because they were getting disproportionately sick from secondhand smoke. And there are many cases on the books about the health hazards of secondhand smoke. And I also think we have to keep that voice of, this is a known carcinogen. We would not allow people in RAD or Section 8 to be exposed to asbestos. And this has to be, going forward, the norm and not the exception. So thank you.
I have a couple of panelists, and then I'll weigh in.
And that's an excellent question. Thank you so much for bringing it up. And I'm glad that Pat just brought up the airplanes. Who remembers being able to smoke in doctor offices? Does anyone remember that? A few hands. How about restaurants? I can remember restaurants, airplanes. So things have changed a lot over the past 10, 20 years, right? And so what we're seeing is that trend is now happening in housing too. It's not just public housing, it's increasingly the private housing. And let me give you an example of that. So in Minnesota, where I'm from, about 10 years ago, when we began doing this work, we knew of 50 apartment buildings that did not allow smoking. And this is private managers. Today, flash forward to today, we now know of over 4,000. So that is a 6,000% increase of the number of private properties that are no longer allowing smoking. So the trend is that it's going to become more and more common to see properties that do not allow smoking in the building. So while private properties don't currently have to, and RAD properties, they will. That's coming down the line and it's going to happen. Yes, that's absolutely. Ask for the deadline date, yeah. So it may not be happening now, but it will be coming. So that is a really excellent question. I'm glad you brought it up. Thank you.
There is, in Section 8, there is a non-smoking policy already in Boston, Massachusetts. My building was the first one that has a for us, no smoking in the building. You have to be 25%. We've started that program first. We've already been put in the book in Washington as well. They've come and represented us, especially in public housing. The lady that's behind me, Mina Carr, can speak on it in 2005 when it first started. So this is already in Boston, Massachusetts, where y'all are coming up. So there is documents that we do have that we can prove with what's going on. Because some of the things that you're saying has already been done. So you just need to look at what the history is, so therefore they can have a better understanding. We come here every year and listen to all the things that you have to say. And most of these things that you're telling us is already put in place. So we appreciate coming here telling you, but we'd like to sometime be able to participate in the opportunity as well to let you know exactly what's going on in our state as well.
Recommend you.
If you don't mind, if I can interject this, Ms. Carr, stand up for a second. Mrs. Carr was one of the first residents in public housing in the country to receive an award for implementing smoke-free housing.
I live in the state of Massachusetts, Boston, and I live with my daughter and my 2 grandsons. Nobody in my family has asthma. And my grandson, the smallest one, he came down with asthma. And I tell people, unless you have a child waking you up at 2 in the morning and telling you he cannot breathe, his heart, he didn't understand slow and fast. He said his heart is beating slow. Yes. This is how he did it. Yes. We went to the hospital. He has asthma. Nobody in my family has asthma. But people in my family did smoke. During that time, in 2005, Boston Public Housing, they found out that there was a high rise of asthma. Right. And they did a survey. And what was found that where they had the highest rise in asthma cases was where there was smoking. So I joined the Asthma Coalition of Massachusetts because I had my grandson, and I love my grandson. So they were going to do a redevelopment of my development. And I asked them if they could make our development smoke-free. What I was told is that is a lot of legals going on. But eventually, we did get it. So, in 2008, we got the okay that we will go smoke-free. We had a mayor, he's dead now, Tom Menino. He was a strong advocate for smoking. So before it became hard rule, in Boston, there was no smoking, even in the private houses. And officially, in 2010, when they opened my development, we became the first development to go smoke-free. And Boston Housing Authority became the first housing authority in the United States of America to go smoke-free. In 2016, the then Secretary of HUD, he came to my development to present me with an award. Oh. I did it for everybody because I strongly believe that we all deserve a healthy environment. So I am not here for your applause. I am here to tell you that we all need to stand up. Let our voices be heard when we have a situation in our surroundings. Because whatever I do for me, I do for you. And if I want to be happy, I want you to be happy. So today I am asking everybody who is here, go back into your community. If you have not yet started, go back and start. It is one step, one voice that brings down everything and lifts up everything. Thank you very much.
Dr. Sam, before you take the next one, I'd just like to do a brief follow-up there. One of the things in terms of for resident leaders, that in Maryland, we work very closely with our legal aid and our legal services bureau as we were putting together our final policy. What these public service attorneys indicated was that they were not going to advocate against going smoke-free. Where their sensitivity lied at was that housing authorities would fairly implement the enforcement of the rules. So this is something we want you also to be mindful about. It is the rule, but what you can help advocate for is for housing authorities not to use smoking or non-smoking punitively to deal with you over some other issue that they can't get you to. So again, that's part of what you're going to hear more about in our breakout sessions, because that has been a concern, the effective implementation of the rule, and what are the penalties, and what are the redresses, and how the courts figure into the process. So put a pin in that for the workshop.
I'm well aware of the effects of smoking, secondhand smoke. I've been a nurse for 30 years. But the problem I'm having is, what about those people that are smoking marijuana for medicinal purposes? Why are they being penalized if they're living in their units and they have to smoke for glaucoma or whatever purpose that they have to smoke it for? But now you're telling this person they can't smoke in their unit, they have to go 25 feet outside their home. Maybe they can't make it outside their home. I don't understand that part. And you have disabled people and elderly people that are bedridden in some of these units, and they can't get out of their units to smoke their cigarettes. I feel for I don't know her name, the woman from Baltimore, but Miss Carr, Madam Carr. But the problem I'm having, I understand that, but everybody's not suffering from those issues. You understand? But I'm just saying, but I'm not disheartening, but I'm just saying, what you do about those particular questions.
Well, I'll give my panelists a shot at it, then I'll take a shot at it. Anybody want to give it a shot? Go right ahead.
Thank you for the question, and that's a really important one that we hear a lot. In terms of marijuana, and again, it's a little bit different around the country wherever you are, right? So some states now where it's legal to smoke it for fun, some states have medicinal marijuana. In Minnesota, it's not legal to smoke it for medicinal reasons, but you can use it in a pill, oil, or a vapor form. So there are other forms. And so what I guess I would caution you, and this is something that we can talk more about in the next session, is that there are some rules that HUD has in terms of marijuana, because marijuana is still illegal at the federal level. And so there are some rules about marijuana. So that's something we can talk about more at the next session, so just to be mindful of that. And something that's good, and again, you can use all of us up here as a resource, is we can have folks come in and talk to residents, and not just about that issue to say, if I'm dealing with medical issues, are there other ways that I can get that doesn't involve smoking? And that might mean a pill or an oil or some other form. Or even if it's 3 a.m. and it's cold and I don't want to go outside to smoke my cigarette, how can I get through those cravings and get through the night so that I don't violate the policy? So that's something that we can all be a resource for, and we can brainstorm with your property. We can come to your property and we can talk with residents and help come up with solutions. Does that sort of answer your question? Okay, thank you. I don't know if anyone wants to add.
I just want to say the disabled person not able to get out, and smoking is also a huge fire concern for fire. But I want to differentiate that disability from smoking, because smoking is not a protected right. Okay, it is not a right. And there are ways to help manage that craving that resident may have that they may not be aware of, that deliver nicotine in a safe way and not smoking. But it definitely is a challenge. It's also an opportunity, because the truth is the vast majority of people that smoke want to quit. And that same vast majority of people don't know or believe there's a way for them. So we've got to help bridge some of that gap, and then help with those circumstances where they're having very strong, very real nicotine withdrawal. Okay, come to the session.
I think that Dr. Leggett did speak a little to what the question that I had, but I'm going to put it forth anyway. And that is, does HUD, or do you know if HUD has something in place for those management services and so forth in the various sites to enforce, the no smoking rule? Because what about they don't even enforce it at all, as opposed to enforcing it, biasly, Is there something that makes them accountable to HUD, who put it in place, to make sure that it's being done? That's my question.
Yes, that's a very good question, and we'll get more into it in the workshop. But what I'll say is that even when we had the focus groups about 3 years running up to the final implementation of the rule, these kinds of things came out where residents and other people were saying that if management can't fix my toilet, or they can't fix my rent, or can't fix my roof, why are they worried about somebody down the hallway smoking cigarettes when they're smoking crack in the elevator? And so again, from a resident leadership standpoint, these are the issues that you can have dialogue around. But one of the things in the final rule that was recommended was progressive discipline. In our housing authority, where we ended up at, was saying is that if there is a fire in your unit, and the fire marshal said a Newport or a Marlboro or a Kool started it, that could expedite a request for eviction. So often people say if you smoke, you're going to get put out. The courts say it's not that simple. We have our attorneys and others in the room. There's a process even for the housing authority to recover a property. So again, the more that you are informed and educated, and our team is available to assist, we can get more follow-up in our workshop, but that's kind of a short version.
Good morning. I'm Reva Iman, and I'm from Tampa Housing Authority. And one of my issues was I'm not for or against I don't smoke. But when the majority of my residents came to me saying that we would like to fight this smoke-free ban, I'm for the majority. Once again, I don't smoke, so I am for the people, the majority. But my biggest issue was when you implemented this program of non-smoke-free, we did have someone come out to the community, speak with the residents, also brought out gum and patches and things of that nature. But what I find is, for a very short time, this gum and patches was given to the residents. After that, you have to purchase it. Well, there's a big fee with that when you have residents that's been smoking for over 20 years or 10 years. So have y'all thought about implementing long-term treatment to help the individuals that's been smoking 10, 5, 20 years to really help them out in this process?
I mean, that is a great question, and we are just getting started on our grant, but that is exactly what we're trying to figure out. So oftentimes there are resources that are available people just don't know about, and so it's a matter of how do you get what you need for the longest amount of time and the most support. So I don't have the answer for that quite yet. I don't know if anybody has anything additional they want to add, but it's something that it's like just throw the stuff at you and go on your merry way. That's what we're here to help answer. And it's not going to be an easy answer in the very short term, but we're working toward an answer for that and working toward helping get support. And it's different state by state and health center by health center, but the idea is that we hope to have enough information to show what works to help get people on board, to get community health centers and state health departments and, maybe Health and Human Services, I don't know, but it is a very real problem that we recognize. Anybody has anything they want to? Oh, excuse me. Nope.
And I just wanted to add, thank you for sharing that. That is a perfect example. I mentioned earlier that we want to hear stories. We want to hear what's working well. We want to hear what challenges are. And as Dr. Little has said too, those are stories we want to collect and we want to share back with HUD. So if there are challenges, and that's a perfect example, please let us know. And those are things that we're going to document, we're going to keep track of, and we want to help you find solutions. So thank you so much for bringing that up.
In fact, as a follow-up to that, I need you to do something to help me. I need everybody in the room to send me an email, briefly of one paragraph describing what your experience has been. Every resident council, every resident services staff in the room, send me an email describing what your experience thus far has been at your housing authority. And what we want to do is collect stories of success, stories of challenge, experiences, period, so that as feedback is provided both to funders and to regulator, we are speaking on behalf of what has happened across the country at housing authorities through the eyes and through the involvement not only of resident leaders, but resident services staff.